Hello. Welcome back to NursingInStyle Podcast, the show where we bring clarity, confidence, and real-world strategy to nurse entrepreneurs and healthcare agency owners ready to build compliant, profitable, high-performing organizations. Today's guest is Melissa Coronado, a national powerhouse in managed care strategy, payer contracting, and healthcare operations. With over 20 years of executive leadership, she's built high-performing payer networks, optimized reimbursement for multi-state organizations, and led rapid expansions for major healthcare companies, including Medics Infusion, Cora Physical Therapy, and U.S. Physitry. As the former CEO of Practice Remedy Consultants, she's launched hundreds of successful medical and ancillary practices across Texas. Melissa is known for her strategic clarity, compliance expertise, and ability to scale organizations with precision and profitability. Listen, profitability. All right. Today's topic is one that almost every new agency struggles with: insurance credentialing. So, today we're going to be cracking the credentialing code, how home health and home care startups get approved by major insurance payers. And today, with this powerhouse guest, we're joined by Melissa, who's going to help to break some of the ins and outs on how to get credentialed, what payers look for, how to streamline the process, and how to position your agency stronger as a partner from day one. So, welcome, Melissa. I am honored to have you as my guest today. And it looks
Thank you.
like on the screen. All right.
Oh, thank you so much. I appreciate it. And absolutely. Thank you for having me, Danielle.
Yes, fantastic. So we're going to jump right in because I know that some people may have just joined and they're probably curious to know some of these comments and things that are happening. Let's see if we can let comments show. I'll let comments be live on the stage. So, Melissa, let's start off a little bit. Share with me a little bit about your background and how you became, how it all came about that you got into credentialing.
Absolutely. Thank you. So my journey into credentialing and payer strategy began more than 20 years ago in provider enrollment and managed care contracting. So early in my career, I worked with Humana health plans and the Texas Medical Association, where I helped develop their credentialing process, some tools that they still use today, and policies that have been used statewide and nationwide. From there, I went on to lead managed care and credentialing departments for some large multi-specialty groups, multi-state rehabilitation companies, specialty medical organizations, and later as vice president of managed care for a national infusion provider. Over these years, I've seen everything from from helping develop the credentialing process, payer negotiations. I've seen all the Medicare and Medicaid enrollment obstacles, the commercial obstacles, delegated credentialing, which is another key phrase that may or may not come up, compliance audits also being a big key part, and just multi-state onboarding programs. So I've spent nearly a decade running my own consulting firm, launching, as you mentioned, hundreds of healthcare practices, everything from different medical specialties to ancillary services, from primary care to very highly specialized clinics. I've helped them do everything from launching, expansion, and building networks. So naturally, this is extended into home health care and a lot of other complementary practice services where credentialing is both more complex and more misunderstood as a whole. So my specialist background really comes from being just deeply involved in every angle of the credentialing for a very long time. So contracting, compliance, government, operational setup. And from this process and seeing it from every side, it's given me a perspective that helps agencies avoid mistakes and position themselves for long-term success.
Mm-hmm. I love it. Whoa, you had quite a long journey there that puts you into the fire. So let's talk. What do most new agency owners misunderstand about the credentialing process? What is
Sure, absolutely. The biggest misconception is thinking that credentialing is just filling out an application.
that part?
That's what most people think it is. It's
Mm-hmm.
actually quite a bit more complex than that, because credentialing is actually the verification process, a
Mm-hmm.
compliance check. It's a readiness assessment all wrapped into one. So owners think that payers just want basic paperwork, and that what they're actually evaluating is whether the agency is operationally ready,
Mm,
and whether their policies match their practices, and whether the staffing is adequate, whether compliance systems are in place, and whether the agency can deliver safe and consistent patient care. Another major misunderstanding is the timeline. A lot of people think this is 30-day turnaround because they hear that a lot. Oh, I got my credentialing done in 30 days. But that's just not the case. So for many payers, especially when it comes to Medicare and Medicaid managed care plans,
mhm.
credentialing can take anywhere from 90 days to 6 months, sometimes longer if the documents are missing or the agency is not fully prepared. So the misunderstanding really comes down to this. It's not, credentialing is not just a formality, it's your first audit. So
Yeah.
that's kind of the preparation standpoint you need to come from.
Oh, I like that. Credentialing is your first audit. Are
Yep.
you really ready?
Yep.
Right? So
Exactly right.
payers give you the check mark, then that they don't want you to be ready to go if you're not truly ready to go. So
That's right.
6 months? Whoo, that's some time. You get your
Yeah.
license and you talking 6 months? Up to
Most,
6 months.
yeah, most of that delayed timeline, I'd say typical 90 to 180 days, but
Okay.
it can go much longer. And that's just simply based on reaction time, and are you responding to their requests
Hmm.
when they send them? Are you fully providing them all the information they need, or are you just trying to click a checkbox,
Hmm.
That's where the formality comes from, and that's where all of these timelines kind of get extended.
All right. You gave everybody a lot of nuggets right there in that answer. So this is something that I hear often. What's the difference between contracting and credentialing that owners need to understand?
Yeah.
It's the same
So
word?
there's a really big difference, and this is the best way I like to think about it. Credentialing verifies who you are and whether or not your standards are being met to provide care, and contracting defines how you get paid. Your reimbursement rates, your billing terms, your operational expectations. Think of credentialing as your background check, and contracting as your job offer.
Yeah. Y'all heard that? I like that. I like that. All right. So, what are the major insurance payers that new agency typically want to get credentialed with? What are the major insurance payers that you believe new agencies like home health, home care, new companies, like even new startup physician practices or NP practices? Which ones should they be going after first?
Yeah, so there's actually a strategy to that too, and it's going to be based on where you're located. You obviously want to go after you want to get your Medicare and Medicaid situated. You also want to go after your bigger major payers, your Blue Cross, your UnitedHealthcare. In some markets, Cigna and Humana are still very big. Aetna, so it really will depend on creating a payer strategy for
Mhm.
contracting. And so typically what I do is, you want to obviously start with the Medicare process. That is the most difficult, it is the most important, and that's the one you've got to really get all your I's dotted and T's crossed first. It's going to help alleviate a lot of the problems down the line with the managed care payers. So we would identify what market you're in. Then we would look at what are the major payers in that market. We would look at major employers in that area, and what health plans do they offer their employees, because we would want to tap into markets where major employers and major payers are keyed into first. Then we would trickle down to the smaller plans. Those are also a lot easier to get into, the smaller plans. So we want to go after the big major payers first because those are going to have the longest timeline and the most probability for denial on the first try.
All right. So go big, then trickle down. Got to have
Yeah.
a strategy of going after that. Go after your Medicare
Correct.
first. I like that. You gave another great nugget. All right. How important is compliance readiness? You already hinted to this. Policies, having your policies ready, your staffing in place, systems together before applying. What all
Yeah.
do you have
This
in order before we apply?
Yeah, this part's absolutely critical. So compliance readiness is the number one thing that payers are going to look for. So if your policies are incomplete, if your staffing doesn't match your service offerings, or if your documentation system isn't functional, your record system isn't functional, payers will hold your application or completely deny it. Being prepared will absolutely shorten your timeline dramatically. And compliance is, like I said, the number one thing, and Medicare will be your first check on how that looks.
Got to come at it together. All right. So we already walked through the typical credentialing timeline. Love that. I don't think we took Medicare timeline. Is it also like that 90 to 180 days, maybe up to 6 months? Is it falling in that same timeline?
So Medicare will sometimes move a little bit faster than your managed care payers, which is an odd thing to say. Medicare has a very streamlined process for all of their specialties and different designations. So the Medicare timeline minimum would be 30 days. I've seen it 30 to 45 days before if you're absolutely prepared and if it's one of the administrative contractors that is working quickly on applications. Some states, you're going to start out at a 6-month wait, like Florida, for instance. Florida, you will start out waiting for 4 to 6 months just to get your application started with them. So these timelines are sometimes really important, that you want to get your operational stuff in place, your business structure, your tax ID, your plans, your compliance programs going. You want to be at least appear operational when you start the application process to Medicare. But because there is a little bit of time frame there, and they will reach out to you and discuss when they want to have an audit with you or a visit with you, they will schedule that. So that gives you a little bit of time to prepare for the nuance, for the little details that you hadn't already prepared for. But Medicare, like I said, it can be as small as 30 to 45 days, but don't get excited about that timeline because it's not realistic for everyone. But some will start out with a 4 to 6 month wait just to get your application touched. So it's really hard to say, but I can give more specific details based on your location, what to expect.
Matters where you stay, where you getting your business started.
That's right.
I'm just gonna say, I know some states are just horrible, but I want to talk about those states. We already talked about what factors can make the process move faster. Having all of your stuff in order will help you not to be delayed. Let's talk about some 3 to 5 mistakes you see new owners make during the credentialing process.
Yeah.
What's the common thing that they just mess up on every time that you always have to come in and fix?
Yeah. The first thing is applying before you're operationally ready.
I've seen that one before.
Yeah, because if they happen to move quick this one time and you're not ready, you will get denied, and then you have to wait 6 months to reapply in some cases.
Ooh,
so that can be really harmful to you. Submitting an incomplete application or any of the documents wrong, they will put themselves on a new timeline. So once they say something's missing or incomplete, they now have a new timeline for you. And once they've reached out to you to explain what they need additionally, you have 30 days to respond. Then they have 30 to 45 days to pick the application back up. So that's another one. Ignoring payer follow-up requests is another one that will greatly greatly reduce your expediency to getting that application approved. So don't ignore any payer follow-up requests. If they ask for something, send it as fast as humanly possible, because you don't want to get stuck in that time crunch waiting again. And then assuming that credentialing and contracting are the same thing is another mistake, because some payers will start your credentialing and then never offer you a contract. So if that happens,
Oh.
you may get into a position where the contract never comes, even though you went through the process of credentialing. So that follow-up and that coordination with the payers imperative. So some companies contract you first, and then once you've agreed and negotiated the rates and the details of the contract, then they will start your credentialing process. So it just depends on the payer which one comes first. And so trying to credential it with every payer at once instead of prioritizing is another big mistake, because like we just talked about, you want to get the big payers first, learn some of the hurdles that you may be encountering, work on the smaller payers later because they are not priority.
I like that. Great nuggets once again. Great nuggets. We already talked about compliance and being ready, staff readiness. You said readiness over and over. You said,
Yes.
be strategic about which payers you're going for. Be strategic about when you're going to apply. Because if they're
Right.
ready to come out and you have no staff there, no one there, you messed yourself up. And then that denial with the 6 month possible block before you can apply again,
Yeah.
that can hurt. That can hurt. So
Yeah,
you
it really can.
nuggets there. Okay, so let's see. Once they are approved and they've gone through all the proper steps, answering your email. So if you submit for credentialing, pay attention to your email. Make sure that someone's assigned to oversee it. Then once you're approved, what should agencies expect next from payers? I heard you say with Medicare, you get the approval, then they're going to schedule a time to come out on site. So
Yeah.
tell us about that.
Yeah. So Medicare has, I have a long list of preparedness things that you would need to be prepared for that site visit from Medicare, all of the things you need to have in place, all of the things you may need to answer to. Sometimes they're just questions that they ask. Other times it's documents they want to see, or policies that they want to read through and grade, essentially, if they're meeting all of the things that they need you to meet. So with Medicare, once you've gotten that approval for a site visit, they'll do the site visit and or phone visit or virtual visit, just depending on your company's situation. Some actually have a home office, some are virtual. So it just, they will work with you on that and either set up an in-person or a virtual check-in. Also, that also may be different by state. In some states, they only do virtual visits, and in some states, they only do the physical visits. So again, knowing what to expect from the intermediary or that MAC is also kind of important to kind of know how they operate there and what the timeline is with them specifically. For instance, again, Florida has its own set of problems. Arizona is another one that you and I both have experience with. They have a whole nother strategy. They want certain licenses and approvals in place with the state before they'll even consider talking to you on the next step. So there are a lot of factors. It's really hard to give a timeline with Medicare because there's so many factors. But the good news about Medicare, and there is good news, is that the date that you apply is going to be key to the date that you're actually able to start billing. So there are rules with Medicare as to how quickly you can apply, as far as you can apply 30 days before your business opens, technically, and you can apply 60 days after the business, or I'm sorry, 60 days before, 30 days after. There's a window there, and in the middle of that is your effective date. You can establish your own effective date as long as it fits within that window. You can assign your own Medicare effective date and say, oh, this is the date I'm going to start. However, if something gets denied or held up, they can reevaluate that date and reassign that effective date if you've gone this far past and you still haven't gotten approved. So they can retroactively effectively date your Medicare. I'm sorry, too many words in there. You can get a retroactive Medicare billing date as long as you are within that 30 to 60 days before or after opening, and as long as you're responding timely, you can set your own effective date. And it can be retroactive, which is really nice. So you can see the Medicare patients, you just can't get paid for them yet. And that's also key because in some cases, you need the Medicare patient documentation to prove to Medicare the things that you have in place.
Yeah, I like that retro part.
Yeah.
Mhm.
So there is a little bit of risk there, that you do have to sometimes see these patients without being fully enrolled, simply so that you can show Medicare you're able to do it.
That's right. I know about that one.
Yeah.
All too well. So, what advice would you give a brand new agency starting the process for the first time? You've been giving little hints all along the way, but let's just wrap it up and put a bow on it. Brand new agency owner, what's your advice to them for the first time?
It's about having a team in place that can help you get it done right the first time. You will waste a lot of time and money if you're not knowing what you're doing, or if you don't have people in place that can consult with you on how to do it right. Because as I mentioned, any denials or any lack of strategy in this realm is going to potentially set you back. So the very first thing you can do, start early, get organized, and don't rush, because these details are so important. So take the time to build a really strong operational foundation first. Credentialing is so much smoother when the agency's already functioning the way the payers expect it to. So getting it done right the first time, and hire someone with experience such as myself, Danielle, to help in these areas will really streamline the situation for you. And strategy for home health and managed care is going to be number one, because the very first thing you need to know about home health care and managed care is that they will say no to you first before they'll ever consider entertaining giving you a contract. So it's really important that when you apply to them, you point out how you differentiate yourself from the other home health companies, because that distinction is going to be your only way in the door on some of the payers. They need to fill a certain thing in their network, and whether it's wound care specialists or
Mhm.
infusion capabilities, there are things that payers need in certain markets that they don't need in others. So having open communication with the payers, with someone such as myself who has people that they can call and to
Yep.
find out what are the secrets to getting in Austin, what are the secrets to getting in Denver.
Yeah.
You kind of got to know what they're missing before you can know how you can fill the hole. So
See, now that's what Coronado Consulting brings to the table. That specialty right there, which is why you are here, that is key. Now, I like that you said that home health, when you're applying for some of these pairs, is going to be a no.
yep.
Don't be discouraged.
Yeah, it's most likely going to be a no first. It's like applying for disability. They're going to say
Right.
no 70 to 90% of the time first, just to get the people that aren't willing to put in the work out of the way.
Yep. Yep. So, see,
Yeah,
no is not really no.
right.
No is go back, ask again, find another strategy, do it again. Know what your niche is. You got to have a niche. What makes you different?
Must,
Yes.
must.
There's many other agencies in your area that's on
Yeah,
this. Why should they take the time to do the work to let your agency in? So
exactly
what
right.
value to that insurance company to show why you should be in a network? That was really good
Oh, well,
information.
thank you. It's going to be key for home health in order to shorten that time frame and to get you a higher acceptance rate. Strategy is going to be the first discussion that you need to have, and you need to open the door to that pair with an explanation of how you're different, because they see home health, they're going to pitch it immediately. If
Yeah.
they've already got a relationship with a home health agency, and that's the case, and with a lot of payers, they just love this company and they only want to use this company. But if that company has holes, that's what we need to get a hold of. Find out where the holes are and how we can fill it and get our way in the door.
Ooh,
Yeah. I have a
you
very long
know it.
questionnaire about healthcare and home health strategy to have that discussion, to try to find what we can do, what we can easily add to our service offerings
Yeah,
that still meet with our staffing plan and our compliance plans, but that may be the thing that get us in the door.
I love it. What is that hole? What is
Yeah,
that area that you need to
exactly
try to
right.
fill? And having a consultant like you, Coronado Consulting, knowing exactly these inside scoops on what areas have lack,
Hmm.
what
Exactly
areas
right.
you know that they'll get in, which angles you need. So it's a whole strategy to this thing. It's not
Really
just
is.
fine and you're done. It's
It's
not.
not just filling out an application anymore.
Yeah, yeah. So I mean, it's like you don't even want to go at this without having an expert who's already built the house, and you've
Yeah.
built many houses. Uh, quote unquote, right?
Yeah.
Under credentialing. So again, more and more great nuggets. So you have already shown that you are the expert in being able to get insurance contracts from multiple agencies, helping companies to expand multi-state, understanding these timelines, understanding what each state needs, because all these states have their own nuances. This is why you get a consultant to help you through these things.
Mhm.
And so, Melissa, if someone wanted to follow you or to get a contract or start talking with you, just have a one-on-one with you to
Yeah.
find out how can I become one of your clients? How can they reach you?
Absolutely. So I've given you my contact information, Danielle, that you can share with your podcast listeners and your YouTube watchers. I would love to set up a one-on-one with anyone that has questions about how we define that strategy, how we start with a compliance program, where do we even begin with the Medicare process. I can help with all of those things. Even putting in, policies and procedures. If you don't have somewhere to start, we can start there, helping with finding a reliable documentation system. But really, the key strategy here, or the key takeaway here, is starting with your payer strategy, because you want to put so many things in place that are going to get you in the door with the payers and get you paid, but you don't want to put out too much money without knowing that you're going to actually secure one of those agreements and be able to provide the services and get paid. So I could gladly put a one-on-one conversation together to talk about what things need to be accomplished still in order to get you started, where we begin in the process. If you're in the middle and you've gotten denied, I can help look at where you're at and what is missing, how we can overcome those things. So I'd be glad to do a one-on-one customized strategy session with anyone and put a proposal together, either project rate or hourly rate, depending on what your needs are. If you need the whole shebang, we can put a project rate together. If you just need me to step in and help with a few, we can put an hourly rate together. But we can come up with a very customized proposal for anybody's needs in the healthcare industry.
Love it. So I will put that in the comments so that you all can like and follow. And if you've been watching the Nursing in Style podcast, be sure to subscribe and like and share. Any new entrepreneurs out there that's trying to get started in the home health, home care industry, or trying to start their new practice, reach out. We have videos like this all the time where we bring the experts right to you. So, Melissa, in closing, I'm going to ask you a question. That I didn't talk to you about. So, you had an opportunity to have a conversation with someone who is no longer here, they've passed away. Who would that person be and what would that conversation be about?
Wow, that's a really good one. I want to have the perfect answer for this. Man, oh man. I mean, the first person I'd like to talk to that's passed on obviously would be my father, but that's not really a contracting strategy discussion or a business strategy. But
Getting to know Melissa. This is personal. This is just some insight into you.
oh, okay.
Who would
Well,
you have
that's really me then, because I am so family centered. Family is everything to me, and healthcare has been a part of my life my whole life. Growing up, my mother was a home healthcare nurse, and she started the hospice program in West Texas. And my whole life growing up, I would follow her to the hospice patients' houses and sing to them and play my little portable keyboard for them. And I made lots of friends that died very quickly after I met them. So as a child, I had to get accustomed to what that looks like. Home health and hospice nursing is very close to my heart and has been my entire life. And one of the things that I would ask my dad was, what did you like about what we did for you near the end? And what did you not like? What would I do differently to care for my mother in the end?
I that makes me want to cry. That was so beautiful.
Well, thanks. I don't want to cry. But I just want to do everything right by my mom. And my only experience as an adult walking someone through that process of death would be, would be that. And I want to know what I did right and what I did wrong so I can do it right by the next one.
I had no idea that your mom was, I had no idea.
Yeah,
She
she's an
worked
angel.
Yes, I had no idea. I knew it was such a kindred spirit between the two of us, but
Yeah.
knowing that little piece about you is just so amazing. It's just another reason why I just feel so connected to you.
Oh,
And
thank you.
yes, the work that you're doing, I see how personal it is. So thank you all so very much for watching, for tuning in. Be sure to reach out to Coronado consultant Melissa Coronado, the expert for your credentialing needs. Goodbye, everybody.
Thank you.